Across America, long-term care providers face unprecedented challenges: staffing mandates, regulatory pressures, and rising costs. Yet each challenge brings an opportunity to innovate, collaborate, and provide care. At PharMerica, we're more than a pharmacy provider. We support local leaders and facilities as advocates and problem solvers. These are stories of resilience and partnership. Voices of Care champions collaboration and innovation, turning local challenges into solutions, shaping the future of long-term care. Rhode Island is where this movement begins.
My name is John Gage. I'm the President and CEO at the Rhode Island Healthcare Association. And our mission is enhancing quality through advocacy and education. We also work closely with the Department of Health, the Executive Office of Health and Human Services, and then we have education that we gear towards areas of concern. We advocate with the state legislature for reasonable regulations, for enhanced reimbursement, and also we've made some strides with a staffing mandate in the state that was unachievable. We've gotten, over the last 4 or 5 years, a 33% increase in Medicaid rates for the nurse homes in the state through our advocacy primarily. We do congressional fly-ins and lobby with the senators and the congresspeople in DC, national nursing home issues. The Rhode Island Healthcare Association is unique because of the geography. We can get together for a training or an education in a central location in any given day. The biggest challenge that we have is workforce. The demographics are such that the demand for our services is going to explode over the next 5-10 years, and the number of caregivers is diminishing. During the pandemic, we were down about 20% of our workforce. We've recovered about half of that. So we're still down more than 10% in the state, where nationally, according to American Healthcare, the numbers are down about 2.1%. So, we're considerably more challenged in that area. The partnership between Rhode Island Healthcare Association and PharMerica helps in our education mission. There's been a lot of medication-related deficiencies that have been very significant, so having competency fairs and having education sessions that are geared towards best practices, that when someone's discharged home, they're discharged home educated and with the appropriate medications and a full understanding. Our members and PharMerica are a partnership that help with that education and then the quality of care. PharMerica has been in long-term care pharmacy business in Rhode Island for as long as I can remember. I've personally gone on tours at the pharmacy in Warwick and gotten to see how the medications are filled from order to being sent out to the facilities. And then I've been on the receiving end in the facilities getting those shipments. The fact that it's close, that we know each other, and that there's, again, relationships. It all comes down to relationships.
Voices of Care celebrates partnerships that strengthen care for every resident. Together, we're shaping a future where facilities thrive and caregivers feel supported. When excellence matters most, partnership matters most.